All right, this is the third part of our sequence. If you remember, this is G. She had a fracture to a number of different parts of her foot like 6 years ago. We did ART, Graston, joint manipulation. Now I need her to do something by herself. So forget the foam roller, drop it. Buy some kind of massage ball. Personally, I like anything that's really firm. You could even use a lacrosse ball, a beastie ball, a trigger therapy ball. I don't care. Just don't use a golf ball or marble. That doesn't work. Take your foot, G, put it on top of the ball, and put it on the inner arch, because we have an inner arch, an outer arch, and a transverse arch. And I want you to take your foot and I want you to mash it in there. Oh, if you could only see her face. As you mash the tissue, I want you to now extend your big toe. Come on, flex it up in the air. If you don't do this, it's always just going to stay short and contracted. Now roll it a little bit, back and forth. Keep it a little slower, but push, push. You're not going to have my hand there to help you. Now move it to the transverse arch, right in the middle. Get your balance, and this flares the toes out. That way it kind of spreads. If you have a neuroma in between your metatarsals, it gives a nice amount of relief for that spot. And just kind of give a little circular motion. And again, make your toes go up and down. You got to make sure that we kind of bring them back to life a little bit. Now let's go to the lateral arch. And I want you to press with enough pressure that you see the fifth metatarsal head raise up in the air. As you smash and mash that area, I want you then to kind of slowly roll it. And again, try to flare your toes up in the air. All right, let's pause. Step 2, got to work out the calf. Go ahead, put your leg on the ball. Now, let's add some extra pressure. Take your leg, put it on top, and just push into it. And as you do this, roll up and down, flex your foot up and down to make sure that you move. Come on, keep on flexing, good. Get a little higher to the popliteal fossa. That's the part behind the leg. Keep moving up, G. You're almost there, come on. Got a little further to go, good. And let's pause. Step 3, we gotta mobilize that ankle. All right, let's get down. Pretend you're getting into the starting blocks like a sprinter. Get this leg a little higher. Good. And now press this ankle down. She doesn't have much dorsiflexion to the ankle, so we're trying to get that ankle to dorsiflex a little bit more on her own so that she doesn't have to rely on just coming into this office. Come on, press into the ground. Get that Achilles down there. Look at her back toes. Excellent for extension of the toes as she's pushing off into the ground. And now come out of that. And we have one more. Last part. We want to engage some plantar flexion. Show plantar flexion. Point your foot. Yes. So for those of you who are limited with plantar flexion, she's pretty good, but I still want her to do this. Go ahead and let's show the move. You get down, kneel back, so you get some pressure right on that front of that ankle, and then go ahead, grab that knee and just power through it, and you hold it for, you should really hold it for like a solid 30 seconds, but for YouTube purposes, we'll cut it short. That's how you mobilize the ankle.